Welcome to this health corner of Ardua Veritatem. Last episode, I talked about the classification and risk factors of diabetes mellitus. Today, I'll be speaking about the signs and symptoms of diabetes as well as its complications. The early signs and symptoms of diabetes include 1. Polyuria, which means frequent urination leading to dehydration. 2. Polydipsia, which is increased thirst and water consumption. 3. Polyphagia, which means excessive eating from increased hunger or appetite. And 4. Weight loss. Other signs and symptoms are fatigue, skin problems, slow healing problems, yeast infections, tingling or numbness in the feet and or toes, blurred vision, and nausea. Diabetes causes damages to the blood vessels, leading to narrowing of these blood vessels. The complications of diabetes mellitus can be either acute or chronic. The acute complications include 1. Diabetic ketoacidosis, a life-threatening medical emergency which occurs mainly in patients with type 1 diabetes. It is characterized by elevated blood sugar and accumulation of ketones in the blood and urine, that is ketoacidosis and ketonuria. 2. Hyperosmolar hyperglycemic states, most commonly seen in patients with type 2 diabetes mellitus. It is also a life-threatening medical emergency. It is characterized by hyperglycemia, which is increased blood sugar level, hyperosmolarity, and dehydration, without significant ketones in the blood and or urine. 3. Hypoglycemia, which is low blood sugar level of less than 50 mg per dl. This occurs in diabetic patients when there is reduced glucose supply and increased exercise with high insulin levels from insulin injections and other antidiabetic drugs. The chronic complications of diabetes mellitus are either microvascular or macrovascular. By microvascular, there is damage to the small blood vessels leading to diseases of the eyes, kidneys, and nerves, which are retinopathy, nephropathy, and neuropathy. By macrovascular complications, there is damage to large blood vessels, which causes angina pectoris, myocardial infarction, transient ischemic attacks and stroke, peripheral arterial diseases, and foot gangrene. On our next episode, I will be discussing the management of diabetes. Please stay tuned. Bye for now.